we're still at Scope, and we're running into some old friends and talking about some of the challenges associated with ECOA and getting different perspectives. Ran into Peter here, and just having an interesting conversation. Wanted to expand on that here.
Sure, thanks, Jordan. And Lindsay, great to see you
Good
again.
to see you too.
Fun to work together again. So the story I shared was what my company does is ultimately we are able to find anomalies in data through clinical trials. And one of my favorite stories involves ECOA, and that is one of the sites, we'll just call it 123, was filling out all of the ePros at 6 o'clock at night.
Okay.
Now, think about that for a second. What are the odds of finding it? Our company was able to find it, but ultimately, what was happening was the site forgot to give this thing out. They ended up filling out the surveys themselves, all doing it all at 6 o'clock in the evening. And you think about our business and what we're supposed to be doing here is really helping people. We're falsifying the data.
Yeah.
Right? They were up against the clock, wanted to get work done, realized they made a mistake, realized they had a commitment, and they went and did it.
Yeah.
And it's an unfortunate part of our business, but I'm fortunate to work for a company that was able to find it.
Yeah.
Right? We were able to find it through our statistical engine, and ultimately that site was removed from the trial. The trial continued successfully.
Okay.
So it's the fun part of what I do in terms of working with ECOAs and so forth.
So you found this. Where do you know in what stage of the study was it? Was it towards the beginning of the study, middle study?
It was early in the study.
Okay, good.
So they were able to remove that site.
Got it.
Once they were informed, they removed the site, and ultimately, they get to the FDA and they didn't have to deal with that issue.
Sure.
And you were saying like that the FDA is always going to be looking, right? Talk a little bit about that. Like, FDA wants to review all of the data, and they use that service.
They use my company's service.
Yeah.
To review all submittals, and they're looking at the data and they're looking for anomalies, and they don't expect perfection, but they expect you to have known about the anomaly and had a strategy to deal with it.
Yeah.
And that's ultimately, nobody expects perfection, but what you don't want, certainly as a sponsor, is to get to the FDA and they go, did you know about?
Right.
And you didn't know.
And I feel like that's something that comes up a lot, where there is this expectation of perfection that nobody really has,
Right.
and then they're doing fraud.
Correct.
To try to get there.
Call it what it is.
Or they're doing, just other things. So the unreasonable expectations about what compliance could be, that if you ever spoke with anybody at the FDA, you would understand that you're making that up, right?
Yeah.
That there's not 100% expectation. Or looking at the data closely and just knowing that you've got a plan. Or we would see examples where they would want to do a sensitivity analysis for absolutely everything, and then we have to say, don't do that, right? Because you don't want to give the impression that you don't have confidence in what you're doing. You need to be monitoring what you're doing.
Correct.
And that's where you're deriving your confidence from.
Correct.
But you shouldn't be giving this impression that you have to go look under every stone, because
Right.
if you do, you will find things.
Correct.
Right?
And again, the FDA doesn't expect perfection. I know everyone thinks they do, but what they expect is you know your data,
Yeah.
Yes.
Yeah.
right? And you know the anomalies, and you have a strategy. You dealt with it, right?
Yeah.
That's ultimately one. And then in the case of that study I talked about, that site was removed. So when it got there, the FDA still found out about it, but they were able to say, well, we removed that site.
Yeah.
It dealt with the anomaly.
Yeah.
Just out of curiosity, do you have any sense for how the ECOA vendor reacted? Like, they weren't privy to this data as it was being collected at 6 o'clock every single night.
Honestly, I don't know the answer to that part of it.
Yeah.
Okay.
I'm sure they were informed, but my part of the story, I don't know that.
Yeah, no, that makes sense.
Yeah. Well, this was great. Thank you so
Yeah.
much, Peter.
Fun seeing you guys.
Yeah, this was awesome. Thanks, Peter. Appreciate it.
Thank you. Good to see you.